I personally know people who worked here. When they retired, they left to go back.
Exactly.
Just looking for us three.
Healthcare is what drove them away. He's a researcher at ORNO. And yesterday they sent an email down to us describing what they felt is the gross distortion of the picture of their healthcare system by the American press. Well, the right wing getting American press.
You're recording us?
Yeah, I got some opinions over there, and I wanted to get y'all's too.
I've heard different places. Wait.
What? May I ask you a question?
Where are you from?
I'm from Knoxville. I'm just a person taking video. I'm interested in the debate. I'm a historian. Why is Obama's plan not socialism?
It's shared risk. We have socialism with Medicare and Social Security. It's shared risk for all Americans so that everyone has coverage. That's my hope. I don't,
So you think?
Label you put on it.
So you think that we do live in sort of like a socialist democracy as it is right now, right?
I'm not going to pigeonhole myself into some category. I believe
I
that
agree.
we should share the risk of the cost. Everyone should share the cost of health care so that everyone can have health care. Pardon?
I said I think that we live in a constitutional monarchy.
And who's king? Obama? King Obama?
Well, not so much. It used to be King George.
Maybe you should talk to her.
It's gotten a lot better.
I believe it's an American value that's is worth the people paying for it.
I understand. I agree.
And we pay for it as the people and not pay shareholders and millions of dollars to CEOs. I believe our dollars need to be spent on health care, not on bureaucracy.
I think that's the crux of the argument, is whether we want our government being responsible for, who says what care we can have and who says what care we can't have, or a for-profit private organization telling us, sorry.
We have ration health care in this country.
Oh, of course,
I'm willing to people do the scare tactics of rationing and waiting for surgeries. I'd be very happy to wait for a surgery, an elective surgery, if someone else or my child or you needed surgery right now, needed health care right now that would make a difference in your life right now. Yes, I would wait. I'll go to the back of the line. I'll be glad to. So
as it is.
It's not so much government telling you in socialized medicine who gives health care and who doesn't. It's opening it up so everyone has fair.
Exactly. There's a choice, and I don't think that's what a lot of those people don't understand, is that they think that if this bill passes, they're going to automatically be forced into this public option, or it's setting some. Yeah,
that's right.
I know.
The pharmaceutical companies and the insurance companies that benefit most when there is non-socialized medicine are stirring up the fear factor.
Yes.
In the people opposing socialized medicine, and they are not making informed decisions. Instead, they're like, "Oh no, you're not going to tell me one more thing that I can do," and they like some of their privileges. But the insurance companies definitely can't.
And they've always been so honest with us before, private for-profit companies, Wall Street, for example, they've always been so honest with us, right?
That's what I was saying. The pharmaceutical companies, the insurance companies, they're the ones making the money. They're the ones cheating the people. We could actually give lots of surgeries and lots of positive health care if the insurance company and pharmaceutical company simply quit buying $1,000 and up gifts for all the doctors that they smooth.
Yeah.
Every pharmaceutical representative in America owns some type of shed or some type of garage that is filled with nothing but incredibly expensive gifts that they are charged to have to give away monthly to doctors to smooth them into certain type of drugs and medications for people to take that's only profitable for the pharmaceutical companies, and to smooth them into only using, accepting certain types of insurance where they can charge the higher rates.
I was talking to some of those people over there, and it's almost as if they want to privatize the actual government. They want the government off of everything. But I mean, what's government for? I mean, they're living in the past. I know. And there was a Vietnam veteran, holding a sign that said, "Vietnam vet ready to fight again," with a Soviet symbol on it. I walked over to him and asked him what that meant, and why the violence, and are you, he just dodged the question and said he meant fighting. He was downplaying the whole violent aspect of
Well,
it. But
the fact that they've risen them to a fear factor of violence should tell them that they are not making intelligent decisions.
you're right. It's misinformation. Like this idea that this bill is going to cover all the illegal immigrants in the country is a complete lie.
That's correct. And Obama is making it fair for everyone. He is trying to get a government of the people and for the people. He truly is. And it's got to start somewhere. At least he's attempting it. The Clintons attempted it, and they tried to here in Tennessee. It didn't go as they predicted, but it was a start.
Yeah.
It has to start somewhere.
Hopefully it gets finished.
Yeah, it would be nice.
It's silly because people who